do one.
Okay.
I have no memory space in my phone.
Okay, so the blood returns back to the heart from the body, the deoxygenated blood, to the right atrium, okay, and that comes through the two vena cavae, the superior and inferior vena cava. And as you know, here the muscle only goes a part of the way, so this has to be the posterior wall. Flip it over, the smooth muscle portion goes all the way to the top of the heart before the vessels begin, so this has to be the anterior wall. You look at the apex, and this isn't the best specimen for it, but look at this left side here. The ventricle goes right down to the apex, and so that means this would have to be the left side, and that's a thicker muscle mass. And then the right, on some hearts it's only a little slit, but this is going to be this is a thinner muscle mass. So you find the tricuspid valve and go above that, and that has to be, so the valve, it's a little mangled, but it's right here, so obviously up above that is going to be the right atrium. The blood goes through the tricuspid valve down into the right ventricle, and then it will be pumped up through the pulmonary semilunar valve into the pulmonary trunk. It will go to the lungs by the right and left pulmonary arteries. It will pick up oxygen and give up carbon dioxide, and then it will return back to the left atrium by the two pairs of pulmonary veins. So we go back to the actual specimen. We said this is the left side here, the ventricle. You see it a little better here, it goes down to the apex. So you find the chordae tendineae, and at the top of the chordae tendineae will be the flaps of the leaflets of the mitral valve or bicuspid valve. So to find the atria, you just go above the valve, directly above the valve. You don't point to muscle, you don't point anywhere else. You go above the valve, and that would be the left atrium. The blood will flow through the valve down into the left ventricle. And again, this top half shows it better. Atrium, chordae tendineae of the valve, and then down into, you can see there's more space down here. This is the left ventricle, the thicker muscle mass. And then you look for the passageway between the interventricular septum and the mitral valve, so the blood will, during ejection, the blood will go up here through the aortic semilunar valve into the aorta and out to the body cells by the systemic circulation. So this is the interventricular septum. A heart attack there would be a septal wall myocardial infarction. The little strings here attached to the AV valves are chordae tendineae, and they attach to the ventricular wall by the papillary muscles. And the rough areas lining the inside of the ventricular walls are the trabeculae carneae.